Hello everyone, hello to my viewers, welcome to my channel. I'm Zion. Hello to everybody out there who is watching me and who is listening to me. So today I'm going to tell you everything concerning angioplastic and after the surgery what you need to do. My name is Zion and welcome to my live stream. Okay, 2 days ago, I had my plastic surgery, that is angioplastic surgery on my chest. I had pain. In my previous videos, I showed you guys how I did my test, CT scan and everything so on, how I found out that I have a blockage, and my blockage was 85%, not even 70, it was 85, and it was left small because there was no way the doctors could just open up and leave. They had to make sure they put stents and balloon also. So I'm going to take through all the procedure that I went through from I was discharged. First of all, let's get by knowing my name. My name is Zion, and I want to tell you that the process is not easy for somebody just to go through. First of all, it was for me to hide from my family, which I'm very, very much sorry for them. I really feel for them. They didn't know about anything. I decided just to hide everything from them. I never wanted to tell them that I'm going for this surgery. First of all, when I found out, I informed them and I saw the reactions on their face and how they were feeling about it. And it gave me a negative side of informing them more about my blockage and how I'm going. So since October 2022, when I informed them, and I told them I'm on medication because I thought the medication will work. Yes, the medication was going well. It was just going fine. Until when I went to the hospital on November 27, and he's not the same doctor that I found, because before I used to go to outpatient cardiologist in HMC, but this time they sent me to heart hospital. That is where now I started my treatment. They pushed me from HMC outpatient to cardiologist, now to heart hospital, where I was dealing with the specialist for the heart hospital. That is where I was sent. So when I went there, I found Dr. Rafi. Yeah, Dr. Rafi. That was my doctor from there. Then Dr. Rafi told me that I need to do the plastic surgery because the medication is not helping at all, like we thought. For once, I thought the medication was helping because I gained some strength. I wasn't feeling weak on my hands. Before, I could feel weak on my hands, and I could literally just lose weight and strength and start shaking, but my bones on this side, they were paining a lot. So when I went to explain to the doctor, why am I having this attack when it comes back? Then my bones become weak. I need to hold on something so tight, and I'm shaking, but there is pain. So the doctor advised me to take the second CT scan again to see how the medication have been reacting with me. Because the neurobics that I was taking with other medication, the neurobics were affecting me. My stomach could just be full every time I feel like I have gas, and I don't have gas at that time. And also I feel like the whole type of food that I eat, it's like bitter on my mouth whenever I put something. So I stopped those medications, and they took the second scan. When they took the second scan, it found out that the blockage was more than before. Literally, the medication was not working at all. Yes, the medication was only giving me the strength to feel that I'm strong, but they were not helping on the blockage at all. So the doctor explained the medication is just like a painkiller to release the pain that I'm feeling, which, yes, the pain was reduced. Then I stayed for another month. Then My appointment was supposed to be December 28th. My third I was not allowed to go to the hospital because during holiday no one will be there. It was on Thursday. So I didn't go for that CT scan again. I had to wait up to this January. When I called the hospital, they told me my appointment is supposed to be on February 10, this month that we're starting tomorrow. So I told the receptions on the phone that I cannot wait until that day. So they decided to push me to 25th of January. That was 3 days ago. So when I went, I found now my blockage from 73, it was 73, it has gone up to 80. Then the doctor advised me, there is no way you can take medication. And believe me, I have a lot of medications. I have this. When I look at all the medication and the medications they gave me, if I insisted on medications, guys, there were so many to the point where I could not go on taking them. So I told the doctor, if I continue taking the medication, maybe they will affect me later on my kidneys or on the livers or another side effect. So I signed the consent form whereby I opted for the surgery immediately. And now my surgery was on 28th this month, just 1 day before, 2 days before, because today started, so my surgery was the 28th morning, 6 a.m. When I arrived at the hospital, now I'm going to take you to the process after. When I reached the hospital at 6:30, I was told to pay for my bed, which I paid for it, which I put a plus to the bed. The surgery, I reached the surgery room. That was daycare, first floor. I went to the daycare unit. I was inserted, the needles there. Then the doctors took the blood. They did everything, and I was rushed to the surgery room. Now, when I reached the surgery room, there is something that my viewers have to know. That room is very cold. It's very cold. The surgery room, it's very cold. Furthermore, not even the room, the patches they apply on your body, you have to be very careful with your body when you're going there, because one thing, you will go there, you'll be naked. The first patch they put for me here, it was very cold. The second patch here on my ribs, and the third one on my thighs, because they were going to use my hand to pass all the plastic and the stents and the balloon. So they used my arm. They did not use my leg. I requested the doctor to use my hand due to my work. Sometimes I'm standing 6 hours. So they opted to use my hand. And the surgery took 26 minutes alone. And I was done from the surgery room. Then now I'm coming to the point where what you should know. You have to know that after the surgery, you will not go home. Maybe the doctor will tell you after the surgery, most cases in most hospitals, they will tell you you will go home after 6 hours or you will go home after 12 hours. But in Qatar, in Hamad, you will have to spend the whole night there. The reason why the doctors opt to put me for a night, because they have to make sure everything is okay. After the surgery, they took my blood test almost 4 times. And also EGCs they have to do for me almost 4 times, because my surgery was 10 a.m. in the morning. And it took 26 minutes alone. After that, 1 p.m. after my lunch, they took the first blood and also the first EGC. Second blood test they removed from me, and EGC came at around 6:30 in the afternoon, in the evening. The third one was around 9 when they took blood from me, and also another EGC. And 4 a.m. in the morning, they have to remove blood on me and also do another EGC. The reason is cooperating with the stents, also trying to see if there is internal bleeding also inside. But the medication they gave me, so I wasn't having any internal bleeding. The doctors check on me multiple times, checking, observing you, talking to you, and knowing if I was okay. But I was okay. I was not afraid. We were talking, we were discussing a lot of things. I was happy because there was no sleep. So the surgery went successfully. I don't think I feel in me. I would just feel there is a discomfort. Something is walking around my chest. That is the only discomfort I have for the moment. But other than that, my hand that was swollen the whole yesterday, now I see it's coming back to shape. I don't have anything, only apart from here, where I'm using to clean and changing my plaster, and also to avoid the water from entering when I'm taking shower. Third point, you have to know that the food, you can eat anything, but not with oil. To drive after the surgery, depending whether you're using your leg or your hand. After the surgery, once you are discharged, you are not supposed to drive or to cook. Like now, I'm not allowed to cook for 1 week because they say if I cook, maybe the heat might come back to the same hand they used, and I will start having internal bleeding because these are the veins. They use the veins. So I'm not allowed to cook or to lift anything at all that is more than 1 kg for 1 week. So I'm supposed to relax. My hand is not supposed to do anything at all. If I have to use something, I will have to use my left hand, but only not to lift more than 2 kgs, even with my left hand, because you know the heart is always on the left side. So they told me not to lift heavy things in order to avoid the internal bleeding. Then after the surgery and after the discharge, you have to know that you will be on medication full time. Surgery is not, because the stents they implanted in me, I had 85% blockage. I'm going to upload my theater video because they have the CD that they give me. I'm going to upload it for my viewers to see how my surgery was, and the team of the doctors I had 7 people inside. I had 3 doctors who were mainly signed to me for the surgery, and other 4 who were helping inside. You know, you have to have somebody who's in the monitor, you have somebody who is giving the doctor all whatever they need. I don't know the team that was on inside there, but I had 3 doctors who are main on me and how the surgery was going on. But the rest were after the surgery. There is medication. Hello Noti, how are you, my friend Noti? Thank you for coming on my live. I'm talking about how my surgery went successful. Hello, welcome Noti. After my surgery, there is the medication that you have to be taking in order to clean your stents. The stents is guaranteed, it's permanent for the rest of my life that I will live on earth. Not unless I come to have another blockage, which I pray to God that I don't end up having another blockage ever again. And for my blockage was not due to the cholesterol, because I do a lot of exercise. The blockage I had was not due to anything related to blood or genetic. No, they took all the measures. They found out it's not genetic. It's not, because we have never had a patient with heart disease in my family, or anyone in my family gone for surgery for any diseases, apart from my son who went for hernia alone, but that one is not related to anything concerning the heart. So they found out it's because of the cold. That's why I had this blockage. That's why I couldn't breathe, because Qatar, it's very cold, and when it's summer, the buildings are also on high ACs. So the cold was eating me from the backside, and that's why I could not breathe very well. That is the reason why it affected the arteries of my heart to pump the blood to flow from my heart. It was all due to the cold, and also lifting some of the heavy stuff. I like lifting things during exercise. So the cold plus heavy lifting things are the reason why I had this blockage. It was not genetic like they were thinking, or from cholesterol. No, because all along I don't eat any food that is cooked with oil. Most of my food are boiled, or I put only 1 teaspoon for cooking. So after the surgery, I have this medication that is called Plavix. This medication, I will have to use them for 1 year. Even after the surgery, I'm going to be on medication. This medication, Plavix, it's for cleaning the stents. The stents to have any form of blockage again. So these tablets, I'm going to use them for 1 year. So like now, these ones are for 1 month. I'm going for taking 1 tablet per month, per day. And this one is per month. Once they finish, every month I have to go back again. And this kind of medication you cannot be given anywhere, in any pharmacy, no matter how much you want to go and buy them. They will not give you in Qatar. Any pharmacy cannot give it to you in Qatar. That is by Qatar law. They will not give you any of this medication anywhere. You have to go, if you go to any pharmacy in Qatar, they will send you to buy to HMC, that is Hamad Medical Clinic, Hospital, Qatar. They will send you, this is where you will get this medication. And even if you go with the doctor's description, they will never sell it to you here in Qatar. All pharmacies, they will refer you to Hamad Hospital. That is the law. They are not allowed to sell any heart medication, all the pharmacies in Qatar. Because when I needed the grisling spray, they told me, according to the law of Qatar, they are not allowed to sell for anyone who have a heart condition, kidney condition. They are not allowed by the Qatar government to sell for anyone any of those medications. So if you have any of this problem, you either go to any of the hospitals, that is biggest hospitals in Qatar, they will give it to you. But pharmacy, it's just the normal aspirin that we use. So this aspirin also, I will use it for the rest of my life that I live on earth, depending on the years that God is going to guide me to live. I'm going to be using this aspirin, and I will be taking 1 aspirin every day, night time. So this is aspirin, and this aspirin, this one doses are for 1 month. Like for 2 months, they will give me for 2 months, 2 months, 2 months. So on Sunday, I have a clinic, so maybe they will give me more. But they give me, this one is for 1 month. I have to be taking 1 tablet every night. The aspirin prevents the morning heart attack. That's why I will be having aspirin every day. So the aspirin, the work of aspirin on my body is to help me not to have the morning heart attack. And also these are the most important that I need to use them. This one for 1 year, I'll be using it until when the doctor will stop me. And this one, I will use it for the rest of my life. Every day, 1 tablet per night before bedtime. And this atrovastin, these medications, I'm only going to use them for 6 months. That is 1 tablet also at bedtime. I'm going to use them for 6 months. Is when after 6 months, I will go for another test to see how the stents is doing. Hello PS Gammas, how are you? How are you doing? Welcome to my channel. I'm just explaining how it was. Thank you so much for coming on top. Thank you so much. So this atrovastin, I'll be taking them for 6 months. I'll be just going through this medication for 6 months, and I'll be taking it 1 per day. Oh, you're doing fine. Thank you so much. If you're doing great, I'm explaining how my surgery went, and I'm happy to please that you are here with me. Thank you so much. You're welcome to my live. I see you're here with Noti also. Thank you so much for coming live. I said I will use them for 6 months. Yes, you know, medicine is not easy. I don't like taking medication every time, but I just have to do it, enable for me to live longer. Then I have this one, this ISD, these tablets that they gave me. I've been using these tablets from October 10. Now I will be using them for 3 months. After the surgery, I need to use them for 3 months, these tablets. Using them for 4 months. And per the doctor's advice is that I should never stop these 2 medications. So to all my friends, I can only ask, because I like forgetting about medication, I don't like them. Thank you so much. I'm feeling well and I hope I will get well soon. Thank you so much, Gamas. So for all my viewers and my friends who know that I like forgetting, please, you can remind me every morning at 9 a.m. or 7 p.m. You can just send me a text, take medication, because I always forget. And I will also try to set a reminder to be taking these 2 every day. I'll make sure I set a phone reminder. He Naughty, I can see you're saying he promise I will get well soon. Naughty, how are you doing, Naughty? Thank you so much for coming on to my live stream, Naughty. After the surgery, now it comes to discharge when you're going home. When you are going home, you are not allowed to go home alone. You need to give to the doctor a number of a family member, or a friend who is here in Qatar, or anyone you know, because you cannot be allowed to check out of the hospital alone. That is per Qatar law. Before, you could go home alone after the surgery and after 1 night staying in. They could allow you to go alone. If you have Uber, somebody to take you. But now they say, due to COVID and a lot of things that are happening around, no one is allowed to leave the hospital after the surgery alone. You need to call a friend. You need also the person. That's great. Not you're editing this now. I hope also you will edit mine. I will send you mine. You will edit it for me one day. And also planning that one day I wish God can open the door so I can visit Philippines one time. So the doctors here in Qatar, according to the policies they have changed due to COVID and everything that is going on, they have decided to change the policy after the surgery and after you are being discharged to go home alone. They are not allowing anybody to go home alone. The final discharge papers, who will help to sign on your discharge forms, you need to have one person by your side before leaving the hospital. Other than that, they will not allow you to go. You have to call someone to come and pick you, someone who will be there, someone who will represent you on the final stage, someone who will help you to dress you, or the nurses can help you, but you need to have at least one member of your family, one member of your friends. Like in Qatar, they know most of the people don't have family members here. So they know, instead of family members, you will come with somebody from the company or your friend. They will tell you to call someone or give out the number, so they call somebody to come and pick you the morning after your surgery. And angioplastic surgery in Qatar, they do it morning hours. After 1 p.m., there is no plastic they are doing. It's only in the morning they are doing, not unless it's emergency, you had a heart attack, then they rushed you with an ambulance. The doctors realize how you were cooperating, how you are dealing, that's when they will do a quick heart attack. But all of them, they tell you to report early in the morning. Like in my case, I was the only patient for Thursday morning shift. I was the only patient, and the stents they put for me, it was the perfect one. Yeah, according to the doctor, they told me they put for me the stents plus the balloon, the plastic balloon to cover the stents on top. Right now, whenever I stand up, I feel like something is walking in me, but it's stuck here. It was only here they placed it, because My heart, like I was viewing it, my heart, the big artery that is surrounding my heart, it was the one that it was blocked, not the other arteries. It was this one that is big one that it was blocked. And I have the video. I will upload for you guys on my video. Don't forget to watch it. I'm going to upload for you the video on everything that happened on the theater room, how my surgery went. Then during the surgery, what I liked it is that the anesthesia they give you, it's just local one, you know, it's just the local one. You will feel all the movements and everything. They don't give you the anesthesia that you have to die. No, they give you a local anesthesia just here. They insert all the needle and the medication. They will freeze only your hand. But when they are pushing the wire, the stents, the balloon, you feel it walking through your veins, going through your heart, and you can see it on the monitoring screen. Everything. You just watch how something, sorry to use this word, but when I was there, I was telling the doctors, am I in a butchery? Because I can see, see the butchery, how the doctors are cutting the meats. You see how they are pushing the wires, how the stents is entering. You can see everything from the monitor. You have to watch everything by yourself, so you don't feel like you are down or you're not, and you are talking to the doctors inside the theater normal. The conversation is normal. You're just having a general talk. The doctors, maybe they can be asking you how many kids you have, how is life in Qatar. They just keeping you entertained at that time. But for me, the doctors were not that much entertained. I could hear them, everything they were discussing. Everything you hear in the theater room, you hear everything. And you just see you on the monitoring screen, you are seeing your heart, all your body organs, how they are. You see on the monitoring screen how your heart is beating. You see everything. You don't die, but the pain, you will not feel any pain, but you could feel how the bulb wire is walking inside you, how the balloon, the only pain you feel, it's for the balloon, because they have to open the balloon. So the balloon is where you will feel there is something shakable in me, but the stents you would feel it. But the balloon, when they are entering the balloon, I felt it until I told the doctor, I feel a little bit pain, and the doctor told me that is the balloon. I could feel the balloon entering in me, and I could watch it, how they wrap it on the stents, how it hold the stents. That was a different reaction I felt that day. And there is no pain, by the way. So I can urge any patient who is going through this, there is no pain. 2, you don't have to be scared. Like me, I was scared before. You don't have to be scared. The process is very short. That is 26 to 30 minutes. If it goes for long, maybe 1 hour, according to patients who have other side complication. Maybe they have sugar level, they have kidney, they have gone through another surgery before. They will stay more hours in the theater, more minutes in the theater room, 30 to 1 hour. But for me, who have never have any reaction or any other genetic disease or any surgery, it was only 26 minutes and I'm done. I'm out of the surgery room. Before, ladies, my nails I used to paint. So during the surgery room, if you are going for the surgery, make sure your nail polish is out. You don't have any nail polish also. You don't make sure you have polished nails, because I gave them hard time to look for nail remover to remove my nails because they were all polished. So to give the doctors hard time also to look for that one to remove, because it's not allowed in the theater room. Also, any ring on your finger, it's not allowed. So it was not allowed in the room. Also earrings, so I removed my earrings. I don't know where I misplaced them. Also earrings, they were not allowed. You have to go inside there naked, only wearing the hospital gown, but nothing, totally nothing on your body. when you are going for the surgery, nothing totally on your body. You will be told by the nurses and everything before going to the theater and after the theater. Now, after the surgery, the food, make sure you eat healthy. You will just eat the normal food. You can eat everything as normal, but make sure you reduce fried food like KFC. I'm a lover of KFC, which I'm going to have a hard time for that. Fried food is not allowed anymore after the angioplastic surgery. You are not allowed to eat any fried food at all. These fried chips, fried food, it's not going to be allowed after the surgery. Until when the doctor will tell you later on you can eat. That one you need from your doctor, they will tell you. My doctor told me I'm not allowed to eat anything fried for the next 3 months. And if I have to eat something like chicken, instead of chicken now, I have to replace with the fish. So from now on, I'm not allowed to eat any chicken. I'm allowed to eat fish, only fish, and especially this sauna fish. That is where they told me to be eating. Vegetables, I can eat all my vegetables as normal. I can use lemon. Yes, they didn't stop me from lemon. I can use apple cider also because it helps also on the blockages. I can use my apple cider with mothers. I can use all the fruits like before. But the banana, I have to eat only one banana per day. If that is, I will have to use banana. This is, each and every doctor and patient. Some of the patients will be told to eat some food. Like my friend told me, my doctor did not restrict me from eating any food. In my case, I have been restricted from some of the food for a period of 3 months. So I order now, I cannot have it. I cannot eat it. I'll just admire it, but I cannot eat it. So that is one side. And also drinking. The part for drinking, they are lucky on my side. I don't drink, I don't smoke. At my age, I don't drink, I don't smoke. So there, the doctors told me I'm better there because they don't need to tell me what kind of drink. Normally, they tell patients to take wine. It helps. But for me, I don't drink anything. Then I'm not allowed to take coffee also. Coffee, I'm not allowed to take coffee because coffee will prevent me from, it's going to cause me more migraine. I have migraine normally. I normally have migraine, so the doctors told me to stop coffee because it will make me have more headache after the angioplastic. So I will not allowed to drink coffee. I'm not allowed to drink because normally I don't drink. I'm not allowed to eat chicken. That is this fried chicken. Anything fried, I'm not allowed. Exercise, I'm not allowed to do any squats. Squats is not allowed. Yeah, I had started squats every day, 30 minutes exercise walk. That is for 1 month. So I have to start after 1 week. I have to start 30 minutes walk every day. That is, I have to do walk for 30 minutes, not more than. I have to do walk for 30 minutes. That is for 1 month after 1 week of the surgery. That is what my doctor informed me to do. So I will start next week, Thursday. That is when I'm going to start my walk, 30 minutes. Once I walk for 30 minutes, that is 30 minutes every day, whether it's morning or evening, because I'll be doing it in the evening. I'll be doing my exercise walk, 30 minutes every day. The exercise will help me to keep the medication working, and it's also to keep my immune system active, not to be lazy, not to make them weak, and also to see if the stents can be in one particular way. Because right now when I move, I'm feeling discomfort because it's still new. But later on, I will get used to it. Once I get used to it, I'll be just okay. It takes time, but I know I'll just have to get used to it. At the moment, I'm doing great. I'm doing fine. I don't have any complications. I do not have any Natty, you sent me a message. Thank you so much, Natty. I saw your message. At the moment, I'm not allowed to run. After 3 weeks is when the doctor told me I can start running after 3 weeks. But for the moment, just to see how my body will react. My first appointment, it will be after 2 weeks. Before angioplastic surgery, patients could go for the first appointment after 3 months of the surgery. Once they are discharged, the first appointment, even in Google, it shows that after 3 months is when you're going for the first appointment. But according to Qatar Hospital, HMC Heart Hospital, they changed the procedure to 2 weeks. After the operation, they changed the procedure. Angioplastic, after, not even angioplastic, after every operation, you have to go for their first appointment. It's going to be after 2 weeks. The procedure that after the surgery, my first appointment will be after 2 weeks. So the appointment that I'm going to take, this one after 2 weeks, they are going to see, they told me they are going to view my stents. I will have to take, it will take like 20 minutes with the doctor, because they are going to check how the stents is working. So they are going to check how the stents is working, and how, if the balloon is still intact, and if everything is intact. So that is what my doctor informed me, that after 2 weeks I will have an appointment. They are going to check all that, also to see how the medication are going on, they are working on me or no. If I have any complication, the earlier the better. I have to explain after 2 weeks. So I have to report. The good thing about Qatar hospitals, that is HMC, even if you forgot your appointment, they will just follow up on you. That is one best thing. I can advise anyone who thinking of flying to India for medication, US for medication, you can also come to Qatar Hamad Hospital, Hamad Heart Surgery. They have also cancer units. They have all the units. I can advise people, if you have an health card, or if you want to come to Qatar also, they have the best facilities. The hospitals are very clean. You cannot hear any smell of medications. They have the best facilities. I will talk that one about Hamad Hospital in another video that I will make about Hamad Hospital. But I can tell viewers, somebody, if you have a relative who is going through the same process that I went through, you can, as well as, instead of flying up to India or flying your country where you will spend a lot of money. Actually, in Qatar, you don't pay a lot of money. The government of Qatar is spending most of their money on the health system. If I were to buy my stents, I could only spend 2,100 QR. Plus bed, that is 200. So the whole amount was supposed to be 2,300 QR. But because I opted, I didn't have to pay anything apart from the bed, which they only charged me 100 QR for the bed. It's supposed to be 200, but the 100 they return it to you after the discharge. So if anybody you are willing to come to, in my country, this surgery, it costs a lot of money, and sometimes it's not successful. But here in Qatar, I've never had anyone saying this kind of procedure, it's not successful. So I wish people, if they can divert also to come to Qatar and try the medical facilities in Qatar, they will be happy about it. At the moment, I am in my house, relaxing. I didn't go back to the camp. I live in the camp, but I came to the house and I'm doing fine. I'm just wishing that I have a quick recovery. I go back to my duties and normal, to go back to resume to work, where I have 1 week sick leave, but I'm not allowed to do anything. I'm not doing anything so far. It's only that my hand, I'm willing it to get much better, which I know it will. And I can say to my viewers, thank you so much for listening to me and taking my time. I don't want to talk so much or spend more than hours, talking, because once I talk too much, I start feeling like I'm losing my breath. I would like to say thank you so much to all my viewers and listening to me, the process that I went through and what I'll be doing after the surgery, my medication that I'll be on to support me for life, the medication that I'll be taking for 6 months, and the medication that I've been taking for 3 months, and my routine for food. I just had to explain to you guys how I will be eating. And thank you for those who listen to me. Thank you for all my viewers. Nochi, are you still there? Nochi, are you still there? I'd like to say bye-bye to Nochi and bye-bye to EG Gaming. Thank you for coming to my live. Bye-bye.